But there's problems here, because when you compare the effectiveness of CBD as an isolate to CBD-rich oil, a whole plant configuration, you get very different results. And to make a long story short, to summarize just one of these studies that have compared single molecule CBD to whole plant CBD, one that was done in Israel last year, I should say. There's one done in Israel in 2015. I don't know when everybody will be seeing this presentation. But, and what they found was essentially this. CBD as an isolate, single molecule CBD, which you can synthesize in a laboratory or extract from a plant and then refine it and just extract out just the CBD itself, it did have therapeutic merit, which stands to reason, but you need very high doses of the CBD, single molecule CBD, and a very precise dose. In other words, it has a narrow therapeutic window. And if you don't get an exact dose, if you have a little too much or a little too low a dose, it doesn't do anything. Whereas a whole plant CBD-rich oil, you need much less of a dose for it to be effective, and it has a much broader therapeutic window, so that you don't have to get an exact dose. And it should confer benefits, and we're seeing tremendous benefits, at least what we're hearing on the grassroots from patients who are using these oils. The other thing is that CBD can interact with many other drugs. Actually, over 60% of pharmaceutical medicines actually do interact with CBD. And we're not hearing problems with that, CBD interactions with other drugs when it's part of a whole plant remedy. But we do know that there's cases when you have a single molecule CBD, very high amounts of it being used, such as in some of the clinical trials on the children with epilepsy. That's where you can get some very problematic drug interactions, where CBD makes the other drugs stay in the body longer, because it delays the metabolism. And some of these other drugs are very toxic, and you don't want to mess around with that. So that's something to keep in mind. And if people are concerned about that, if you're going to be utilizing CBD therapeutically, even if it's a whole plant, you're concerned about drug interactions, consider this as an option, a very practical thing. You may recall that sometimes a doctor will tell you when he gives you a prescription, well, make sure you don't drink any grape juice before you take that, because the grape juice has something in it which will alter the metabolism of that pharmaceutical. Well, CBD acts in the same way, except it's much more potent than the grapefruit component. So you might want to ask your doctor whether he's friendly to cannabis or not. Doc, are these other drugs that I'm taking, do they react in any way with grapefruit? Well, if they do, that's a red flag that you might want to make sure that the blood levels of these other drugs, let's say it's a blood thinner, for example, and CBD is known to react or interact and delay the metabolism of blood thinners, meaning they stay in the body longer, so one should have their levels checked. Typically, if you're on something like warfarin, you check it every month. Well, maybe you want to check it a couple of weeks straight. So one should take these medicines seriously. They're very potent. This is not kid stuff, but it's very, very promising, this whole area of cannabis therapeutics. So many different people with so many different conditions are benefiting. So the take-home message is to keep in mind, cannabis therapeutics is personalized medicine. At least initially, it's about the person more than the condition. You're treating a person. There's no single ratio, dosage, strain, or product that's right for everybody. That CBD and THC, they're the power couple of cannabinoid medicine. They work best together. And that whole plant CBD-rich cannabis is safer and more effective than single molecule CBD.